welcome back. Dr. D again from Advanced Healing Institute. So this is our second video on arthritis. So on this video, we're going to focus on osteoarthritis and treatments. So osteoarthritis, degenerative wear and tear, is really a disease that cannot be prevented. Everybody, especially as the population is going to get older, is going to have some degree of osteoarthritis. What you can do is help stop its progression or slow down its progression. Now, by far, the most important thing you can do to slow down or halt your arthritis is to be active, meaning exercise on a regular basis up to 4 times a week. Very importantly, maintain a healthy weight, and also do weight training up to 4 times a week to strengthen your muscles to lower the stress on your joints. That is by far the best way for management and you can almost say avoidance of osteoarthritis. Next, really comes down to the management of the symptoms with medications. So common medications we use for treatment of osteoarthritis includes acetaminophen, Tylenol, NSAIDs, which are non-steroidal anti-inflammatory drugs, such as Motrin or Advil. We discourage the long-term use of this because of cardiovascular and GI side effects. Any other stronger medications, such as opioids, I do not recommend in my clinic because I think there are much better ways to manage osteoarthritis, and based on the side effect and dependency of opioids, it is something that should really not be used. The next thing that we do very commonly in our clinic is targeted ultrasound-guided injections. So using different agents such as steroid shot, cortisone, hyaluronic acid for lubricating the joint, stem cell therapy, and platelet-rich plasma therapy. Historically, we've been using cortisone and steroids for a long time to help mask the pain and lower the inflammation. In the last few years, platelet-rich plasma therapy has become more and more popular due to its helpful effects of decreasing the pain but also stopping the progression of osteoarthritis. And this was done on a very important study in the Hospital of Special Surgery, which is one of the top hospitals in the nation in rheumatology and orthopedics, was that they studied a number of patients who had arthritis and had undergone PRP treatments. And they also looked at their MRI before and months following after treatments and measured the amount of cartilage loss. So what they found is PRP treatment actually helps slow or stop cartilage loss after they had reviewed these patients over a certain period of time. So this is a very good treatment, and with lack of any side effects, that is probably going to just become more and more popular in the future. Now, the final treatment really is surgery. Now, surgery is really reserved for severe bone-on-bone cases. In most cases, which is mild to moderate, or even moderate to severe osteoarthritis, injections such as PRP can have very good results and hopefully slow or stop your progression and avoid having surgery. But once it's bone on bone, these injections do not help for longer than a few weeks. And that's when you're going to need to have surgery such as a joint replacement. So the key is to catch it early and try to avoid surgery in the long run. Hope that helps. The next video will be on rheumatoid arthritis and treatment. Thank you for watching.